afternoon, everybody. My name is Lisa Butler, and I'm the Executive Director at the GBS-CIDP Foundation. Welcome to our third episode of Ask the Experts. This is a monthly series where we bring to you experts that we think will have relevance to you and your journey wherever you are. So today we're going to talk about managing reimbursement, insurance, and financial assistance. Our expert today joining us is Alicia Lawrence from NORD, or the National Organization of Rare Disorders, and Alicia is the Information and Resource Services Manager. But before we get started, I want to thank our sponsors, CSL Behring, Grifols, and Takeda, and I want to draw your attention to the note at the bottom of the screen, which reminds you that information presented today during the Ask the Experts webinars is intended for general education purposes only and should not be construed as advising on diagnosis or treatment of GBS, CIDP, MMN, or any other medical condition. As always, all decisions regarding your healthcare should be made by you and your personal physician. So with that, let's get started. We have some questions already prepared, and Alicia and I are going to have sort of a Q&A interviewing kind of conversation, but we also want to make sure that we give you the opportunity to ask your questions. So you can type them in the Q&A box at the bottom of your screen, and please understand that if we don't get to your question today, we will follow up with you after the program. Also, this program is meant to be educational, and I'm sure you understand we can't address specific individual questions, but we will do our best. So today we're going to go through some definitions of some common terms in the reimbursement conversation. We're going to go through some common scenarios, and Alicia has some great resources that she's going to share with us. So as you know, GBS, CIDP, and related conditions are complex, and they require a complex and extensive treatment regimen. Immune globulin, or IVIG, is typically the standard treatment, but because of how rare these conditions are, sometimes the insurance process doesn't always go as smoothly as we would like. So today, Alicia is going to talk to us about how to handle some of these scenarios. Alicia is a licensed master social worker and has great experience working in the patient community on these topics. So let's get started, Alicia, by talking through some of the vernacular. What do these words mean, and how can we understand the conversations we're in? So can we start with the word premium?
Certainly. Hello, everyone, and thank you for joining us. Hopefully it'll be informative. And so let's just get started. Premium. So premiums are the monthly cost for health insurance. So this can include co-pays as well as deductibles. So every month, whether you're working, commercial insurance, or commercial insurance, or even if it is that you're getting through the marketplace, it's your premium is what you pay monthly in order to continue to have insurance. That may differ, but for the most part, that's what premium is.
And we talk a lot about having a deductible. What does that mean, and how does that relate to your premium?
I think a lot of individuals get very confused with that. So deductible is basically the amount you pay before your services are even rendered, as far as the services that insurance will pay. So this is usually on a yearly basis. So sometimes you may hear someone say, my deductible is $2,000, which means that in order for your insurance to start kicking in, sometimes you have to meet the $2,000 deductible before your insurance will actually start to cover your services.
And sometimes that deductible amount is something you can choose up front.
Yes, it does depend on the insurance. A lot of companies have different types of insurance. So it's always important to make sure that even if it's a Blue Cross, it's important to just make sure that that particular Blue Cross coverage is the one that meets your needs, because there are different types of coverages. So you just want to be mindful of that.
And then they all have different levels of deductibles, right?
Yes, yes.
Okay. And how about out-of-pocket costs? How is that different?
So out-of-pocket costs are services that are not reimbursed by the insurance. So this can get dicey. So it may be that, for instance, it may be that you're on a medication that is not formulary with your insurance. So if it is that it's not, then you have to pay out of pocket for that. If it is that it's an equipment or a test. So those are the things that you pay out of pocket that are not covered under your insurance.
So you just mentioned that word formulary. Can we go back to what that might mean?
Sure. So formulary is your medication. So it's always important when you're choosing a policy, an insurance policy, that your current Medicaid, we're kind of skipping all over the place, but your insurance covers your current medication as well as your medical providers, because if not, then you could incur an out-of-pocket cost. And sometimes that can be very expensive.
Hmm. And this is something you could talk to your insurance company about before you make those
Yes,
decisions.
yes, you can, there's, usually for the most part, the number to the insurance company is on the back of your car. There'll be a customer service number, usually a claims number. It'll say something about for providers, but you want to maybe speak to a customer service representative or even claims. Sometimes they might be able to help too.
Okay. And how about on-label and off-label? That's a common term in our space.
Yes, so on-label is drugs covered by or approved by the FDA for your specific diagnosis. Off-label they are also FDA drugs, but they're not drugs that are approved for your particular diagnosis. And being in the rare disease space, we do find that a lot of medications are off-label because they're not being used, for lack of a better word, the traditional reason why they were made what they were made for. And so you'll find that providers may feel like, this particular medication, for example, I'm just thinking, I'm not a medical provider, but arthritis, if there's a particular medication that may do well with another neurological or, muscular diagnosis, and it's really for arthritis and not necessarily for that particular diagnosis, then your provider will have to call the insurance company and try to get authorization or off-label use to use the drug, which, we'll talk about too.
So it doesn't, off-label does not mean that the drug is not appropriate. It just means that it doesn't have the language designated by the FDA.
Correct.
For
For
a
that
specific use.
particular diagnosis. So that's what off-label is. Not that it's a drug that hasn't been approved. It's an approved drug, but just not for the use of certain conditions.
Right. So for our viewers, you could be taking an immune globulin product that is considered off-label, but that is something that you should work with your insurance company to get an approval for. But I'm getting ahead. So speaking of approval, what do we mean when we talk about an approval, Alicia?
So approval is basically that your insurance company has approved the medication, test, or treatment or provider visit under your particular plan. So that's what approval really is in a nutshell.
And how about the opposite? How about a denial?
A denial is what the insurance company feels is not service, they're not paying for services rendered, and for the same reasons. It could be that it's a provider that's out of network. It could be that the medication, like we talked about, is not on their list of medications they approve, and the same for tests and treatments. So it's always really important to make sure that if you're not sure if it's a new test or a new drug, you want to make sure that your insurance company will pay for it before rendering the service, because sometimes those things can be very, very expensive.
And when all else fails, we can do something called file an appeal.
Yes. And so the appeal is, of course, when what we talked about, if there's a denial, if something that your provider feels you really need, or even a test, it's a request to review the claim that's being submitted to the insurance company. It's important to know that this is your right, and it could be a lengthy process. There's usually 3 steps to an appeal. So if it is that they don't they denied the first appeal, you can always ask for a second appeal. You can always ask for a third appeal. But it's always important to know that that is your right to request an appeal.
And can you talk a little bit more specifically about that appeal process? Who initiates it and what needs to be collected, and how does
Sure.
that process work?
So, you know, a patient or caregiver could call the insurance company and request an appeal, but I always suggest maybe having the doctor do it, because sometimes it's a little easier and they can do a peer-to-peer, and then that will cover, you know, the initial first appeal. So it could be your provider or it could be yourself. And again, you would call the number on the back of your card, a customer service number, and just say you'd like to start your appeal process. And then they would walk you through the steps to do that.
Mhm. And do you have any thoughts on how effective that can be?
It depends. It's really on a case by case. And so, you know, some people do tend to really fight and advocate for the determination. Others may not know that there is more than one appeal. So, you know, sometimes I'll get calls from someone who says, I already appealed it. And I said, well, did you maybe go through the second appeal? And sometimes they're not aware that there is more than just the one appeal. So you could also, I'm kind of jumping, but there's also, you can go through, you know, to your state insurance fund. Every state has an insurance, a state insurance fund or office, and which controls the insurance you know, insurance for the state. And so you can always get assistance through that resource as well.
And how would people find those?
So it's going to be one of the list of resources I sent on our Nord site. We have another part of our organization, which is more geared toward policy and advocacy, and it's called the Rare Action Network. And we have a link that is called the State Profile. It's very informative. It has information on how your state is doing as far as the rare disease community, how it, you know, what are some of the things that changes they've made. Also, that information regarding the state insurance office is on every state. So you would basically go there and, you know, like I said, we'll share the link, and then you click on your state and it'll actually show you like the Medicaid office, the marketplace. If it is you're having trouble or feeling like you're not getting what you need out of the insurance and you go through the state and it's still not, there's also a place for you to put in your zip code and find out who your US representative is, because, you know, not everyone knows, but usually your representative has a health safety or a health entity to their team or their cabinet. And so that's another option too.
Okay, very helpful. And going back to the appeal process, who should patients ask for for instance, in their doctor's office to help them with this?
Usually it could be sometimes it's the nurse, but you know, of course you have the conversation with your doctor. Some doctors do it themselves, but you know, they may have an office assistant that is able to start that appeal process for a patient too. So it depends on the doctor or the provider's office how they handle that when appeals come in.
Okay. And somewhat relatedly, we hear a lot about prior authorization. Can you describe that?
So prior authorization is something that I encourage, you know, as people to do, especially if it is, again, a test that you're not used to, you know, you haven't had, just wanting to make sure that your insurance company doesn't have a problem with it. They may then ask for prior authorization for a particular test, treatment, or medication. And what your doctor can do is your doctor can call and speak to another doctor. Usually that's how it works. And they will speak to the why it's necessary for you to have whatever treatment or whatever the reason the prior authorization is needed. And then you wait the game of waiting for it to be approved to which will determine if you can get the test or not. If you decide to do it without the prior authorization, then you risk getting the cost, which is what goes back to our out-of-pocket cost.
So it sounds like, since we are in, the rare disease community here, that prior authorization is probably a really good idea, whether it's for your medication or a test.
Yeah, because if it is that you decide that you're just going to go with it, the potential to get a bill, especially for our community, is really happens more often than not. So you just really want to make sure you're in touch with your insurance company to make sure they are going to cover the things that you do need.
So we talked about having 3 opportunities to appeal a denial. Do we also have 3 opportunities to appeal prior approval?
You can. Again, it's one of those things where you have to be an advocate for yourself, and your doctor really has to prove a point. It's not that the provider could just call and say we need it. If it's something that is really necessary, you have to showcase or cause for the insurance company to approve it.
So I think some other advice to our listeners here, right? If the doctor is prescribing the medication, if the doctor is suggesting the test, the doctor's office, whoever that may be there, should really be the ones helping you through this process. You should not feel alone.
Yes, absolutely. I would also encourage, if it is that, if there's such as your organization, such as yourself, if there's someone who can kind of, if it is a process, it could be very overwhelming. So if there's someone that has been through it, through support groups, reaching out to any supports you might have in place. We try to assist as well at NORD through our information. You can call our information and resource services team, and we would try to just listen to what you're trying to do, and then be able to provide you with the right guidance, because again, it really does depend on what the situation is.
Right. Okay, thank you. So I'm going to change the topic a little bit and ask you to talk to us about step therapy.
Okay. So step therapy is when the insurance company wants you to do the traditional way of medication. So let's just say that it requires the insurance company may require you to take the one or more medications chosen by that insurance company, before you can access any optional medical treatment. And so, while it was, of course, created to contain costs, it doesn't work usually in the rare disease community. And so I'm not sure if the bill has been passed, but I know Congress we also participated in hopefully a bill that can help with that, so that it kind of limits how we are affected as a rare disease community as it comes to step therapy. Because, as we said, traditional ways of medication doesn't always work, and having to go through that step can harm a patient while they're waiting for the insurance company to decide that well, you have to do this first in order for us to even think about other treatment. And so we're trying to work on avoiding that if possible, because in the end it doesn't help patients at all.
So I know NORD has a bill that they're supporting against step therapy, and the foundation is also supporting that this doesn't apply to our community. I think this is a great example of where the government makes a sweeping decision, but sort of overlooks the needs of the rare disease community.
Yes.
Yeah. So I'm going to change the topic a little bit too, and talk about disability. So our conditions can certainly trigger a certain level of disability. So how does a person go about if they feel that they might qualify for disability? How do they work through that?
Okay. So just to be clear, state disability and federal are two different things. So each state has their own rules and regulations as it relates to, if you're maybe need short-term disability, I would suggest, going to your state's website to see how that works. However, Social Security is a federal program, and so the federal is throughout the country, so that doesn't change. And so usually the first step is there's certain requirements you have to meet in order to be considered eligible for disability through Social Security. Of course, your medical condition has to be lasting longer than, I believe it's a year. Your provider, of course, has to write, something to say that, this condition allows you not to be able to work or, do gainful employment. And so, it's that you need to apply for disability. There's also what's called a compassionate allowance. And this is a list that Social Security has put in place where certain diagnoses are on this list. Not every disorder is on the list, but it does help in being able to qualify for disability. The determination, once you start the application, can take 4 to 5 months, depending on what's necessary. So some of the things they require, and again, this is something that we can put in resources. Of course, they'll send paperwork to your doctor for your doctor to fill out. They'll want to know your medical history extensively. So they'll ask for medical records. They'll ask for letters from, you have, of course, have to show that you've worked. If you haven't worked, it's still the same thing, because there's Social Security disability, which is the program, if you have worked, that you would get money from. And there's also supplemental security income, which is a needs-based program. It doesn't matter which one you're applying for, it's still the same process. You have to show that you're not able to work longer for more than a year, that it's going to go past the year in order to qualify. It's a tedious process, but that's the way it is, unfortunately.
Yeah, and so for our community, who part of our community manages a chronic condition where they're taking therapy every week, 2, 3, 4 weeks.
Mhm.
So while they're going through the process, they would still be able to access their insurance and have their therapy. This doesn't hold their treatment
No,
regimen, is what I'm saying.
no.
Right.
It's a separate entity. It doesn't have anything so even if it is that you're working, but you're still considered gainfully employed, or you have insurance through your job or insurance period, that's totally different than when you're applying for Social Security disability. You could still have your test. That's income. It's not related to insurance, it's more related to income. However, when you do apply for supplemental security income, it does, allow you to be automatically eligible for Medicaid and some of the benefits that come along with that. But for disability, the Social Security disability, it's two separate entities. You could still do your treatments and stuff while you're applying for disability, as long as
Okay.
you have the insurance.
So what about for the people out there that are uninsured? What kind of options do they have?
For those who are uninsured, there's the marketplace. I always tell patients who call and say that they're uninsured to contact their local Department of Social Services first to see what programs they may be eligible for. If that's not, if you're not eligible for any programs through there, then of course, then there is the marketplace. Again, also something to think about is to just make sure, again, that if you're uninsured, you can always access clinics. A lot of the bigger hospitals, academic medical centers do have programs for those who are uninsured. So if you have a, you know, if you have an academic medical center in your area, it might be, you could contact the case management office, or, because they may know what services may be available. Sometimes there's clinics affiliated with the hospital that serve as well, underinsured and uninsured patients too.
Okay, okay. And you were talking before about Medicaid when we were talking about disability. Can you define Medicaid as different from Medicare for us?
Sure. So Medicaid is also like supplemental security income, a needs-based program. So you have to meet certain financial income criteria in order to apply for Medicaid. And that does range again from state to state. It depends on your state. Whereas Medicare is what, if an individual is working and paying into the Medicare system, and you see that on your pay stub, then, and you have to have, don't quote me, but you have to have a certain number of work credits in order to qualify for Social Security disability, which would then allow you to be eligible for Medicare. So Medicare is a program that, that you have paid into, versus Medicaid is a needs-based program. And so sometimes even for Medicaid, if you're a little over the threshold, but you still want the Medicaid, you may have to pay what's called a spend down back to Medicaid in order to continue to have your Medicaid on a monthly basis.
So Medicaid, you can have access to if you're younger. Medicare comes later.
Well, not necessarily. Medicaid can be for anyone. So as long as you meet the criteria, it doesn't matter if you're older or younger. You just have to meet certain criteria. Medicare, if you are a disabled child under your parents, you could potentially get Medicare through your parents.
Right.
So, you know, that would be the only difference between the two.
Okay. And you mentioned the offices of social services as a good resource for all of this, really, right? And that is that by county, by state?
So each state has a Medicaid, and then under the Medicaid, each county has designated offices in the county for for Medicaid. So you don't necessarily have to go like to the capital for it. Usually it's by county, and then in the county, there's usually offices in the county that will help with the applications. You can also, in some states, you can actually apply online. You don't necessarily have to go into the office. So I would say to look at that as well, if that might be a problem getting to the actual physical office.
Okay, great. Well, thank you. I really appreciate talking through some of these questions. They're all questions that we've received from our audience in the past. And I wanted to turn our time now to some of the resources that are available. I know we spoke about some before the program, but I wondered if you could talk about some of the financial assistance programs and resources that are available.
Sure. So, as stated earlier, NORD, we do have patient assistance programs, but some of them are disease specific, but as stated, our information and resource services team, if we do not have a program, we do look for other resources that may be available. Sometimes resources are not necessarily disease specific, but more geared towards just medical needs. For myself personally, if someone is calling for a patient assistance program, and maybe it's a disorder that doesn't necessarily have a an actual assistance program, then, we try to think of other resources that may be available. One thing that might be something to look at is sometimes disease specific organizations may have patient assistance programs available that can help. If that's not the case, there are some organizations like the Assistance Fund, PAN Foundation, who also, may have resources available. You could also maybe contact the drug manufacturer for the particular medication you're looking to get copay assistance for, to see if there are any programs you might be eligible for directly through the manufacturer. And also, myself, I try to think out of the box. So let's just say someone has a copay of $400 or $500 and it's not something they can afford, and there's no programs that may be able to help, then, we try to see if there's other resources that could help with, like rental assistance for the year, or you know, your lights, just ways to cut costs that may free up some money. Sometimes also, if you're a veteran or active military or veteran, there are some services available through the VA. And so I would encourage, those who can or have served to reach out to their local VA to see what, assistance may be available to them through there. There's also resources that may be you can access through your state. There's this organization called findhelp.org, where you put in your zip code, and it gives you resources that may be able to help. Again, it may not be so much under your medication, but again, if other resources that may be available that you may qualify for to help free up money for your medication. So sometimes it's thinking outside of the box. There are, again, more general types of organizations that provide assistance if you're a nurse, if you are a single parent. There are some organizations even that specific. So I usually just tell patients to give me just few information, some information, and I'm able to explore whatever resources we can find to help them. There's a lot out there, but if you don't know, you don't know. So.
Right. Those are great suggestions. I think so often we focus on assistance directly related to our diseases, our diagnosis. But I like how you said that, freeing up some money in some other places, and that there are resources that we can look at. I know in my own family, we were able to get some funding from a grant that the state of Pennsylvania had.
Right.
So very important. I do want to mention that there is a program through NORD for Guillain-Barré assistance, financial assistance. There is a program for CIDP through the Assistance Fund, or TAF, that's the acronym, the Assistance Fund. And then through a program at Assessia, there is a financial assistance program for MMN. Now, these programs sometimes open and close, sometimes there's a waiting list. But we always encourage you to put your name on the waiting list, because you never know when those programs will be refunded. If they're closed, they're usually temporarily closed. Right. So please check often. But again, those are funds that are very specific to your disease. And Alicia was suggesting that you look at all other aspects of your life, and that there could be some other funding that you could look for in some places that you might not be thinking of.
Yeah.
How about asking your infusion provider or your infusion clinic? Do you have any thoughts about that, Alicia?
I think that's also a good idea. If it is that are having a hard time, speak to them. Maybe they may actually have programs, and it may not be a big program, but they may be able to say, we can help by giving, we can't pay for the whole thing, but we can relieve some of the money. They may also work with other resources too. They may have other resources in the area where your infusion or where your infusion provider is, that may have access to grants that are available, because I'm sure it's not something that they haven't heard. So, it's worth a shot to even speak to them as well.
So it sounds like it's important to, as you consider alternate resources, that you may need to be considering several alternate resources at one time, and that it may take some time to work the system, but that ultimately it's a valuable process to go through if you're
Yes.
looking for assistance. How about Medicare? Do you have advice for folks aging on to Medicare, what they should be thinking of, how they should be evaluating how to sign up and what kind of plan to choose? I know could be a giant program in and of itself, but just maybe some high level sort of direction for folks.
Yes. So, what we talked about, if you are getting ready to go into the Medicare system, what we talked about as far as looking at specific plans, and in doing that, making sure that if it is that you want to keep your current providers, going to your providers and saying, hey, I'm getting ready to get Medicare. Do you take Medicare or Medicare Advantage plans? And Medicare Advantage plans are those plans that allow you to have like your dental work, glasses, so they call it Medicare Advantage. But that's usually through like Blue Cross, Aetna, Humana. Those are some of the Medicare plans. So it's just important, if it is that you're looking to continue with the services you currently have in place, to just make sure that your providers are in network. What are they in network with, so that you can at least choose a plan that they are in network with. And then as far as your medication, you could always speak to your pharmacist and find out, hey, I'm looking to go into Medicare. I just want to make sure that I can continue to take these medications without there being a big copay for the medication, because that's also could be an issue too. And so your pharmacist should be able to help you with that as well. Or if it is that what plan you may want to, sign up with, making sure that you call them to make sure that they take your doctors, to make sure that they do have and what the copay would be for those particular medications. Medicare.gov does have a great resource, and it's very easy to read and look at on how to sign up for a Medicare plan. And you can also, there's a couple of there's a state health insurance assistance program, which again will provide those resources, is also a good tool as well.
Okay. Helpful. It seems like a complex tunnel that we're all heading into, right?
Yes.
So another question for you, we've talked about some terms, we've talked about some processes, we've talked about some resources. What is your sort of overall advice for patients in the rare disease community navigating this reimbursement atmosphere? How can we be our best own advocates?
I think communication is important. I think it's really good to have a good relationship with your medical team. Don't be afraid to ask any questions as it relates to your medical needs, and also the financial needs that it may arise. I think it's important to be able to have those conversations with your team, and also to understand what your insurance will and will not cover. If you're feeling like you're a little doubtful of if this particular test is going to be covered, or if the doctor is telling you need this test, if you know where you're going to get the test, maybe calling to find out what would be the out-of-pocket cost if my insurance denies this. Just having an idea, pre-planning if you can, what how you're going to decide or how you're going to navigate your insurance, or whatever it is that you need to do. You can always call your insurance company. It doesn't matter if you call them 20 times, in the end, you are advocating for yourself. You are trying to prevent yourself from being overwhelmed by financial bills. And sometimes you also want to make sure, if you get a bill and you're really like, I don't understand why this wasn't paid, sometimes the coding is wrong. And that's a whole nother subject. But, if it is that you know what you went there for, you can ask, well, how is this coded? And, the coding is, you can just Google ICD-10 codes and put in your diagnosis, and it will come up, because sometimes, it's not covered because it was coded wrong by the office. So, and that's a simple fix. And I hear that often. So I would suggest just asking for an itemized copy of your bill if you're able to do so. You are your strongest advocate,
right?
and there's organizations to support you, but if it is that you're looking for immediate, resolution to something, just, always know that you can turn to your insurance company. Your provider should also be available to assist in any way. And, you know, I'll provide my information as well if you need to contact us at NORD, or even if you have a support group. You never know, somebody usually may have been going through something that you're experiencing, and I suggest reaching out that way too.
Absolutely. Well, Alicia, I can't thank you enough for sharing your experiences and your expertise and your guidance. Alicia has shared the 800 number at NORD, and we will put out a report after this, and you'll have access to all of these. But the number to reach Alicia's team is 800-469-0283. You can also reach out to Alicia's office at informationservices@rarediseases.org. informationservices@rarediseases.org. You can also certainly reach out to the foundation here, and we will put you in touch with any resources that we have. I think it's important for everybody to remember that all of this is a process, and that you're going to have to be prepared to work the process. But I hope that it's yields what you're looking for in the end. So I think that concludes our discussion today. I want to thank Alicia for joining us and giving us her time again. And hope that you will join us next month in April for our Ask the Expert sessions. We're going to talk about some emotional issues. So please join us in April. And if you have additional questions, again, please email us at info@gbs-cidp.org. So again, I'm Lisa Butler. Thank you so much for joining us today, and we hope you found this program helpful. Thanks again to Grifols, Takeda, and CSL Behring for their support of this program.